Good, so now I'm going to explain the procedure. I'm going to be performing your catheter insertion today. So essentially that's a sterile tube that's going to go through your urethra, that's going to sit in your bladder held in place with a balloon. It's going to continuously drain urine. That's going to be into a drainage bag that's going to be secured to your leg with tape. So it might feel a bit painful or discomfort upon insertion. So that's part of the acute kidney infection workup, so we need to monitor your ins and outs for the next 72 hours. So now I can start setting up my area here. So all my equipment here is intact. You want to make sure none of the edges are perforated or anything like that. So I'm going to start with my drainage bag here. So just stepping that to an area, there's lines, just an area here, and then you want to attach the actual bag itself to a non-movable part of the bed, just because that would be awful if it were a movable part, because that would be really painful. So that's there. You want to make sure whatever under here is sterile, but we'll be worrying about that more later. Okay, so I'm just going to put that to the side there. So I'm going to start setting up the patient. So I'm going to move back the bedding there just to expose the genitalia, and we have the curtains to maintain privacy. So exposing the vagina there. So you want to position the patient for a female in the dorsal recumbent position with the knees flexed there. So kind of like a frog-like position. So they're like that, and then we're going to perform hand hygiene and start setting up our sterile field. So just, it's been opened a billion times, but that's, so there. Okay, so opening the package here, we're going to wing that back, that back, that back, that back. So I'm going to start putting the drapes down. The first is our non-fenestrated drape.
So I just want to mention that before even taking it off, I am already seeing a little bit of shrinkage on that outer dressing.
And we're placing that in between the patient's legs.
The adhesives, and then open it up so I can see.
And then if we do need to reposition, we'll do that after. But now we're grabbing the fenestrated drapes. That was the non-fenestrated drape.
I would say like 30% saturation with serosanguinous exiting. Next is the inner
Placing this over the genitalia.
100% saturated with serosanguinous exudate as well.
And again, if we need to reposition, we'll do that after.
So,
grabbing my garbage bag.
note of that information so that I can document it later. Next thing I'm going to do is I'm going to fold this
Placing that there. Opening the catheter. So it's been opened a billion times, but essentially you wouldn't want to touch the blue inside because that packaging is sterile. So when you wing it back, you want to keep it winged back. Again, it's been opened like a bunch of times, but essentially that part is sterile. You don't want to touch that. Grabbing that out with my forceps. Okay. And then that can go there. And then, so I'm going to put on my sterile gloves here. So again, these have also been opened a bunch of times, but so winging these back here.
The next thing we have is this cash bag, which I'm going to pass to myself. So I'm just going to set this.
And then we're grabbing only the outside of the cuff for these.
Accessible to me later while I'm cleaning.
Sliding them on. And grabbing the inside of the cuff for these ones. Making sure they're not touching the skin. So now these can't drop below my waist. So I'm going to start setting up my boat. Taking off the sterile packaging there. Checking the end to make sure it's intact, which it is. Attaching my sterile water to my balloon port, or the port for that. And then propping up my cleaning swabs. And then this would be an unopened thing of lube, so you'd open that, apply that to the end there. So just because it's a female, this is about as far. So go. So now I can place the boat in between my patient's legs in a sterile field. So that'll be like that. And because we have a female, we're going to retract the labia with our non-dominant hand. I'm just going to fix that a little bit. Okay. So I'm just going to retract the labia with my non-dominant hand to clean. I'm going from urethra to anus, from far side, near side, center. One swipe per wipe. So retracting the labia and going swipe on the outside and then the inside, and then down in the center. And then, not taking away my hand, I'm going to insert the catheter. So you want to let the patient know to bear down as avoiding. You always want to keep the patient involved. So I'm going to take my catheter there and then insert that there. And so for a female, it's about 2 to 3 inches, but you want to go until you see urine coming out. So I'll say we've seen urine, go another 1 to 2 inches. So now we're going to hold the tubing with our non-dominant hand to stabilize. And inserting the sterile water, you want to make sure you're not reading any resistance, because that could mean you're in the urethra. You also, it's a good idea to look at your patient's facial expressions, just if they are nonverbal, to look to see if they're grimacing, because that could show that it is in the urethra. So slowly injecting that there.
Hopefully my swab sticks would not.
And we'll do a gentle tug just to make sure it's sitting in the bladder, which it is. And we can take that off. And I'm just going to put that to the side there. So that's probably draining urine at this point. Now anything under here is sterile, so we want to make sure we're maintaining sterility with that. Taking that off there. Applying that to the correct port. And that would be secured to the patient's leg with tape. We perform pericare, just getting off the iodine or any excess lube. We clean up our bedside, rip the fenestrated drape, take off our gloves, dispose of those, perform hand hygiene. I'm not actually going to throw them in the garbage, I'm just going to put them here. Perform hand hygiene, do a safety check before leaving the patient's room, so making sure the patient's not in any distress, the bed's lowered, the brakes are on, the railings are up except for 1 foot railing is lowered, the call bell is in reach, they're comfortable, again, don't need anything else, no distress. In terms of what we've been documenting, we are documenting the time the Foley was inserted, the size of the Foley, so a 14 French Foley, the amount of sterile water that was used to inflate the tube, so 10 milliliters of the sterile water, any characteristics of the urine that came out, so color, amount, sediments, any hematuria with that. You want to monitor you want to record how the patient tolerated the procedure, as well as the fact that we'll be monitoring the input and output over the next 72 hours, and to monitor for any signs of infection.